A warm smile evening to each one of you. Thank you for joining in this session. This session is presented by Joshi's Kerala Group and Sujok International Association by Bhupinder Ma'am. So this session comes for all of you to enlighten you about Sujok, Triorigin, seed therapy, and all the other meditation and everything else, smile meditation and everything else about Sujok coming from our international trainer and the well loved, most loved, dedicated Bhupinder ma'am. So now we have her here just before all of us, and we all of us will be awaiting so much for these sessions. I know that very well. So without wasting much time, let us all invite Bhupinder ma'am with her warm hearts and smiles for this wonderful session on joints, especially for knee pain. So today's session mostly will be on knee pain and how to address it. So let us welcome ma'am with all our hearts filled with love and dedication for this session, please. Ma'am, good evening. Thank you so much for coming and giving us your valuable sessions with lots of love, dedication, and passion. Gratitude, ma'am. Good evening. Please take over the session and smile evening to you.
Thank you so much, Anusha, for your kind words. I'm really grateful to be here. Thank you so much. Okay. Just a moment. So I cannot see my waiting. Just a moment.
Yes, ma'am. Now you are able to see?
Yes. Thank you. So straight away, we are coming to the main point. Today, I want to discuss about knee joint. Of course, we will discuss more joints also, like uh, elbow joint, frozen shoulder, tennis elbow. But today, my main concern is knee pain or disease related to knee. Now, uh, when we talk about knee, sometimes one single point can help us. Sometimes one color therapy or one point needle can cure this disease. But uh, when you don't see the result, you need to explore more. That is why today I will touch all the dimensions of Sujok from beginner's point of view. Yes, I'll make it simple. I'll simplify so that you can do practically, you can do treatment on your hand. If it is required, you can help your friends, family, and patients. So let us now start with knee point. One by one, I will touch all points under the banner of level 1, level 2, level 3, level 4 also. I'll share triurgent tip how to treat. So it doesn't mean that you have to use everything. Yes, you never know that. 6 key tip can heal, triurgent, one tip can help, or just by, Meridian Sujoki, one bar magnet application can cure. So I'll give you all varieties and you never know. You should know everything because if you're not getting result from this, then maybe this is working. Yes, we what is happening inside the body actually we don't know. Sometimes it is the disturbance of energy field. Sometimes it is structure problem. Sometimes it is like problem of some uh, medical, from surgical point of view, some medical history is there. So we have to know everything. Okay, so I want to share my screen now. So one by one, we'll go. Now, as you all know, the basic system of Sujok correspondence system. This is very simple, but still we need to focus in detail, because if we miss one point, then result is not coming. Accuracy is important. Yes, so we will target accuracy today. So please focus. And I'm sure that out of 100 knee patients, you will succeed in 90 patients. Why not 10? Because, of course, sometimes we need advanced knowledge also. And here I'm giving tips from beginner's point of view. If you listen carefully, I will also give demonstration practically. I will show you how to do it on hand. It will really help you. Yes. So now, quickly, I will revise this basic system. Most of you know. So, first of all, where is the knee point in basic correspondence system? As you all know, that hand is similar to human body. Yes. So, this is the trunk part, squarish part, and here in the hand, you see this is the trunk part. And then from the trunk, we see 5 projection. 5. And here also from the square part, from the trunk part, we see 5 projection. So middle two fingers, as you see, I'm focusing just knee. Yes, not telling that complete story because you know everything about basic system. Most of you know. And we have videos also on basic system. We can send those videos. So because my main aim is to show practical aspect. Now, middle two fingers are representing your legs. And in legs, you see 3 joints: hip joint, knee joint, and ankle joint. Yes. So in hand, middle two fingers, legs, and on the same level, you can see hip joint, top joint, knee joint, middle, ankle joint. So this is the place. But in this area also, where is the exact knee point? Yes, sometimes patient is saying, okay, I'm having pain on my kneecap area or left side of knee, right side of knee, back side of knee. Yes. So if person is having pain in all direction, then this joint you can focusing that 4 direction like a ring. You can focus like a ring or covering all 4 direction. Now, uh, how to find the knee point, exact knee point. Now, in this picture, you see the standing position or posture of human body, how this person is standing. Focus this. It is not like this, as you see, for example. So if you observe this here, you will find that kneecap, knee area is uh, in the front edge side. Yes. But in this picture, knee is in the side direction. This is center line, for example. Yes. So knee is far from the center line. But here, knee you see close to the center line. And in this picture, you see yang surface. You are aware of yin and yang. So this leg, yin is soft, fair, and also has contraction quality. So this part is showing yang surface, face, neck, chest, abdomen. This is yin. Yes, we can bend also, but when you come to the legs and you fold your legs, contraction area goes backward. Yes, so yin side goes backward. So this is yang. When you see this picture, as soon as you open your legs, then yin is fully exposed. Yes. So this is yin area. In this posture, you see complete yin. Okay. Now, a human body can perform many postures. Standing straight, bending, crawling, sitting, yes, opening legs, or in straight position, natural position, because human body is very higher when you compare with the animal world, can do all kinds of posture. But which posture you have to select? This is important. When you see this hand, it is completely yin, fair part. You see this part, all yin, fair. Front hand, this is yin. Back, this is yang. So first try to understand that the surface, this surface is totally yin surface. There is no yang here. Now, when you see this body in this posture is showing complete yin. Okay. So as I told you that human body can perform many postures, but we have to select that posture of human body which can match with the hand. Yes, hand has its own beauty because we say that hand is similar to human body, but at the same time, this hand has its own identity also because hand is doing many practical works. Yes, and hand is also representing human body. So hand is maintaining both features. Hand we are using for work, all kinds of work, and also it is representing human body. That is why hand has limitation. But human body can, because human body is representing body features and hand is representing body as well as healing platform. So we select this posture of human body. Open legs. This is important. Open legs. So here is the central line, and when we open, then kneecap comes here. Yes. So here, now this is Sujok body. Just try to imagine this posture on the hand. Yes. Central line running between two legs. So in this condition, in open leg condition, kneecap comes here. It is on the yin yang line level. Kneecap comes here. So now this area is kneecap area. Where is the pain exactly? If patient says that pain is here, then you are treating this point. Okay. But if patient says that I have pain just behind the knee cap, just behind. Yes. So same thing you can transfer here. Behind the knee cap here. Yes. Just behind. And then if pain is here, now this is yin surface. Easy to transfer this area. This area is yin and back side of finger is yang. So if pain is here in this area, then you have to stimulate this part. And if pain is in the back side, back, then stimulate back side of hand, back. Okay. So in basic system, this is the knee point and all direction of knee. Yes. Now, in foot also same. Generally, we give more attention on the foot, hand and foot actually. Hand, Su is hand and Jok is foot. It is good to treat both, Su, Jok, hand and foot. But diseases below the diaphragm, If you add foot treatment, then it gives very powerful result. So legs are below the diaphragm. Special attention. You should give special attention on foot also. Yes. Only thing is you have to, because toes are small, so you have to really focus, and you should have very good uh, sitting chair or bed. Patient can lie down and you can focus these points. You have to really focus these points. Yes, because minute, this is micro type of point. Now, same pattern. Yes, if you have understood this, then same pattern you have to see here in foot. Middle two toes are representing the knee. Two legs, and the knee is here, centered area. Now, when you see the foot, when you see the foot, you will see two lines here. On the finger, you see three lines, but in toe, you see two lines. Yes, but it doesn't mean that toe has two junction. Skin level, you will see two, but when you see from joint level, then toe also has three joints. So bend the toe. When you bend the toe, yes, then the protruding joint is the knee joint. So you can check your toes, just bend. And the base is the hip joint, and the joint just near the knee is ankle joint. Here we are focusing knee joint. So how to find the knee joint? You bend the toe, and then projected joint is knee area. So this is the place. Yes. And same way, side points, exact. This is knee. Sometimes small star magnet in this area can cure that pain. Quick relief, very fast relief is coming. So this one, this point, small point on the yin yang line, like this one, just one point application, one needle, one seed, one small black pepper, or one small star magnet on this point, you can see magical result. Yes. Now, if patient has four direction pain, then you can tie fenugreek strip. You can cover that joint, complete joint. Or you can do target point treatment on the hand, because hand has good scope. You can spread fingers and easy to treat. So finding painful point you can do on the hand, and in toe you can just tie fenugreek strip and you can cover that complete joint. Yes, vice versa also you can do. Idea is to attend both. If you have good knowledge of finding the painful point, then try to find the painful point exactly in this area. Very sharp, sensitive, painful point, micro point you will find, but sharp circuit pain, if patient experiences, that is the point. Okay, I will show how to do it. Now, so this is knee in basic system. This knee point is based on the standing position of human body. Okay, now we have another dimension, that is sitting posture, and it is also very good. Hand has information of variety of points based on the postures. So sometimes people say that I have pain when I'm sitting. On sitting, I get pain. While folding leg, I have pain. Standing is very good for me. When I'm standing, I don't have pain, but sitting, it gives pain. Yes. So sitting, this is called sitting posture. It also has detailed information. Sitting posture, we have yoga posture, sitting postures, but to make it very simple, just easy to understand. Middle two fingers are legs, you know. Now, if you see middle two fingers, just focus your middle two fingers. Bend, open, bend, open. It gives the, it gives you the glimpse of legs, walking legs, sitting legs. Yes, like this, sitting legs. So for sitting, you have to bend your legs. Yes. So this posture of fingers are representing sitting posture of the legs. Is minute point, but very powerful. So this is the leg, yes, and here the same principle. When you see sitting posture, this whole area becomes kneecap. So, if person is having problem during sitting, pain during sitting, then better we focus this. And also when you are doing ring massage, it will cover all four direction, warming up and attending all the directions of this knee area. So you should know sitting pain, this is the place you have to find the painful point. So with the help of probe, we are checking the area. We are checking all the points in this area. So it is easy. If patient has front, we are focusing here. And if patient is having back side, then exactly back on the yin surface, we are trying to find the points. Okay. And then very interesting thing is for chronic knee pains, here I want to focus for all chronic, like if person is having a new disease of knee, then just basic system can help very easily. Sometimes patient has very chronic old disease, many years, then better we use axis of reflection also. You can add this ring massage based on axis of reflection in new diseases also. Yes, for quick recovery. This is very interesting and very powerful approach, focusing axis of reflection. So what is this now? So in our body, we have metaphysical axis. Now these axes are folding body and keeping body as complete one unit, united. It is a framework which it is like pillars of building. Pillars are holding the building. Same way, we also have pillars, and these pillars are folding our body because we have different pieces. We have left arm, right arm, left leg, right leg, head, neck. So all these pieces are united because of these pillars. When person dies, then these pillars are disintegrated and body is also, merges with the five elements. So these pillars are metaphysical pillars. You can imagine like a mirror. So it acts like a mirror. Now, what happens that, for example, this is knee area because it is mirrored. So the image, because of this mirror, now we have, first of all, we need to understand that we have vertical axis, vertical mirror, horizontal axis, horizontal mirror, and then we have diagonal axis, two diagonal axis. Our diagonal axis is is uniting left arm and right leg, and this side, right diagonal axis, is uniting this is right arm and left leg. You see, that is why when you walk, yes, with your left arm, right leg is coming forward. This is because of this axis. Yes. Have you ever seen that your left arm and left, while walking, left arm and left leg coming forward? No. With left arm, right leg is coming forward because of these axes. Yes. So these axes are very powerful. These are spiritual axes, powerful axes. Because of these axes, and these axes are acting like a mirror for and because of this mirror, then the reflection of the area is reflected across the mirror, maintaining the same distance. For example, if you see horizontal, imagine this is horizontal mirror. Yes, horizontal mirror. Now this is mirror. Now the reflection of this left knee will come here on the left elbow. So this is left elbow. Yes. At the same time, the shadow, the reflection of left knee will overlap here. Yes, I'm giving you very important tip. Thanks to Professor Park Jebu for exploring this, and it can help it can really enhance your knee treatment. So left, so this is horizontal axis, horizontal mirror, metaphysical mirror. So image of left knee will come here. Yes. And if you see vertical, from vertical point of view, vertical mirror. Yes. So the image, so this is the actually the disease target. Now, vertical axis, in this case, the image of left knee will come here on the right knee, maintaining the equal distance. You see, this is the equal distance. Okay. And when you see from diagonal axis perspective, then the image of left knee will fall here on the right elbow. So you see, maintaining the same distance. And I will give you then simple tip also. I will simplify. In this case, easy reflection point, you know that this is the knee area. Now, see the shadow of this area exactly here. Same. Yes, just in Sujok, it is easy, very easy to find this reflection area. Very easy. Because you know this is left knee. Just near the left knee, you will find the image, reflection point. So this is right knee. This is the right knee, and the reflection point is here. And to summarize, if person has any problem in the middle joint, let it be left knee or right knee, it means the reflection point. If you choose this one, then all reflection points you will see on the middle joint. Simple. Now let's talk in a very simple way so that beginners can understand. If person has left knee problem, then all reflection points will come on the middle joint. Here, here, here. Yes. If person has problem in the right knee, again, this is middle joint. So all reflection points will appear on the middle joint again. Yes. And same story goes with wrist joint or hip joint that we will talk in our next session. Today our session is about knee. Okay. Now Oh, how do you use this? Okay. Person having knee problem. Now you have understood that all these middle joints are carrying reflection of knee. Then, first of all, you can focus ring massage on all the middle joints. Yes. Of course, target is this. You can tell your patient to do ring massage here. I'm talking about this ring massage. Yes. You can focus your left knee, but additionally, do ring massage in these joints also. Yes, because middle joints carry reflection points. Okay. And also sometimes in very severe pain, yes, after attending the main target area, you can also search painful point or you can simply tie Methi strip on the middle joints, all middle joints. Yes, if patient is having very severe strong pain. Okay. Now, in finger system. Yes, in finger system. Again, finger system is very good. Basic system has 4 direction. You need very good focus to find the painful point one by one. Check, 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 check all direction. Yes. In insect system, easy, very easy. Because just one point is your knee point. Here, this is insect system, arm, leg. So here, this above, this is the central line, central joint. I'm talking about central joint. So here above the joint is elbow, just below the joint is the knee, and this is on the yin yang level. In yin yang line, this is yin yang line, this is side view, this is nail, nail. So when you keep your finger like this, see side line on this side line. This yin yang line means the side line means it is dividing yin surface and yang surface. So this line is running exactly between yang and yin surface. So very simple to find knee point. Only thing is now you have to know left and right because this finger, I will show you in practical session exactly how to find left knee and right knee. But idea is that just below this line is knee point here, right knee, and here left knee. Yes. So we have to check all. As I told you, sometimes just 1 point treatment, when we reach the correct point, 1 point, in many cases I've experienced just 1 point, one small seed, one star magnet on 1 point cures the disease. But sometimes we have to explore more. We need to know everything about knee. Yes. So now mini system. Mini system actually you have to really practice. But now I'm just focusing simple tip. Yes, it is not difficult if you just because in correspondence area to treat correspondence system we don't need special state of consciousness. We need to reach the correct point. Yes, even if we don't know complete Sujok and with guidance, if you reach the with someone's help, if you reach the correct point, result is come. That is why don't worry if you don't know, but try to focus this area. Okay. Now middle two fingers are the legs. Yes. So this for knee, you have to focus middle finger and ring finger, and just simply it is like nail. This is the nail, and near the root of the nail, if I turn this picture like this, yes, you see your finger, simply like this, easy to find the point. So you all can see the nail, and just below the nail, you have uh, these fingers, toes area. Now, where is knee point? In picture, it looks big area, but when you do on your real hand, then it is very simple to find. Just below the nail. Yes, in hand, it is very simple. Okay, I'll show you in another picture. See the nail. So in this area, you have to find the painful point. Simple. Don't just focus where is the uh, uh, here, where is the full body as per Meridian system. Just pay attention to the area which is below the nail. This area. Simple. Okay. And check this area one by one. If you know mini system, then you will save your time, then you will search in the exact place. Yes, but doesn't matter. This is not big work. You can search here. And don't forget, this is yang surface. And yang surface is bony area. And you have to press gently, not very hard. Because you have to experience on your finger before you do it on patient thumb. If you press deep, then this is giving extra pain. It is not Sujok pain. Sujok pain has a mission to find the painful point. If you are giving pain more than the target, more than the desire, uh, then it will create a wound on patient hand. So don't do it very deep. So first you experience on your hand and then you try on your patient. So not very hard pressure. Check one by one, and wherever you find the pain. But general idea, you know that middle two fingers, we have 5 fingers, and middle area is the leg area. Yes, leg area. So for knee area, you can search in the central area, this area. Yeah. So fenugreek seed, 2, 3 fenugreek seed, you can tie here to touch this knee area. And these fenugreek seed will not just touch knee area, but also it will touch nearby joints also, but it doesn't matter. Yes. So here you have to pay attention. And then important thing is, especially in chronic cases, like in level 1, I always say that in all old diseases, chronic diseases, you should focus lumbar treatment also. In 5-step treatment, we have this process. Yes. Step 1, we are finding the target point. Step 2, we are doing surrounding point. And then step 3, we are doing as per medical history or endocrine glands. And step 4, we are treating the spinal because spine is controlling all parts of body. And last final point is brain point. In all diseases, if we follow this procedure, then it will show bright result. Okay, now for knee, lumbar 3 and lumbar 4, we should treat this. Don't neglect this because nerves coming out from this area is connected to your knees. So where is L3, L4? This is the lumbar area. So just focus the square part and how to reach. I'm giving you general idea. I'm not giving you exact framework, just simple general idea so that immediately you can start. Okay? So not make it complicated. So first is focus the square then central line between two legs, and then this is the center part, exact center point. You will touch the lumbar area. Now, after finding the center point, you check one by one up and down near the center point. This will cover, automatically it will cover lumbar area. Yes, again, between two legs, center line, then center point here. Now check up and down this area. Stimulate, though we have to focus L3 and L4. Yes, you can find, when you're checking, you will find the painful point. You will automatically touch L3, L4 because patient may have pain here. So we can fix seat here after doing good massage. And in insect system is easy. This is the place. This is the base of finger. Yes, base of finger. So actually for all leg diseases, for knee joint and leg diseases, yes, this area you should stimulate. So easy way is first reach the skin level line. You see the last line, base line here on the finger base line, and go back side. This line is touching the base line. This is lumbar. Yes, stimulate this area and try to find a painful point. Or you can fix chain of seeds here, though our target is L3 and L4. It doesn't matter if you are adding extra seed. Idea is to hit L3 and L4. Yes. So for beginner point of view, I'm making it easy. Automatically you will touch L3 and L4. Okay. And then energy point in old diseases. Yeah. So middle two fingers are legs, and the energy point on the inside. These 2 points are supplying energy to two legs. So lower points near the legs. Better you stimulate. It is not necessary that you put seeds everywhere. Yes, you can just stimulate. You can do moxa in chronic cases. You can do moxa. You can stimulate this point. Yes, and check back side also, front side also. Here our concept is not finding painful point, stimulate. On the inside, stimulate in clockwise direction, and on the yang side, stimulate in anti-clockwise. You can put a seed also. Also stimulation and moxa is very effective. You see, one sitting, if you do it, one sitting, good sitting, energy point stimulation, checking L3, L4 points and knee point and good ring massage. Just with simple baby steps, patient can immediately say, oh, my pain is gone. Yes, only thing is that for chronic cases, we have to do it for few days regularly. I will recommend that. Don't leave this treatment in between, because in my experience, I have seen people recovering, rejuvenating, and good target treatment and doing every day for few days, this knee pain will not come back. Of course, you have to pay attention to your lifestyle also. That is very important. Lifestyle, emotion, that is very important, not only in organ disease, but also in joints disease. In all diseases, we have to focus lifestyle, mental, emotional health. That is very important. Now, please don't scribble. Once again, I will share so that I can
Yes,
find
please.
fresh scheme.
I request everyone to not touch your screens, please. Thank you.
So Now I want to focus meridian here. Now, which meridian is passing near knee? So two meridians are passing near the knee. This is stomach meridian outside, outside. This is stomach meridian here. And another meridian is spleen meridian on the inside. This is kneecap. This is like you can imagine kneecap in the center and stomach meridian and spleen meridian. Between these two meridian, kneecap is there. So these two meridians are going or passing near the kneecap. So you can try with stomach meridian first. Now this is like stomach meridian. You see, this is stomach meridian. And one point I like very much, that is ending point. Sometimes one seed here and little bit of stimulation in the correspondence area of knee or simple tying methi strip on that area, tying methi strip covering without finding painful point, you see, and then attaching one seed here. This is very painful point actually. With probe, you can stimulate this area and see this is the corner of the nail, that to this side, not towards the thumb, but this side. Don't forget, it is not here, it is here. So patient with knee pain, especially if patient is having pain on the outer side, then this point is very good. Stomach meridian ending point. So after stimulating, 6 fenugreek seed or green lentil small seed. And now on the hand, this is stomach meridian. Nail side, yang surface, just near the, you can remember like this, near the index finger. Here, this is index finger. So stomach meridian. And you can see this nail, the corner of this nail, exactly here. This is stomach meridian running here. So now we can fix here seed chain. We can make seed chain also. If we don't know Meridian Sujok key to support your treatment in a line, we can nourish the stomach meridian. It is very helpful in stomach diseases also. Okay. And I will also tell wire. You can fix wire, especially when patient has pain symptoms in present moment. You can fix bar magnet or wire on this meridian, tonification or sedation. You can check the direction and pain, you will see pain is reduced, and then you can do correspondent treatment if it is old disease. In new disease, just one sitting is enough. Tonification or sedation of this meridian is enough. So this is stomach meridian. And spleen meridian is on the inside. The inside, you know, this was the knee area. If you remember, this is the knee area. So near the knee, on the inside, you have spleen meridian. And here, this is nail area, knee point on the yang side, stomach meridian. Yes. So easy to remember. This is like a landmark you never forget, because here in basic system you saw kneecap here. Yes. So on the inside, this is spleen meridian near the kneecap. Yes, easy to remember. And then when you turn your hand on the back side, exactly back side, nail side, exactly back of this, you will find stomach meridian. And then I will show in practical how to use this. In 6 key, participants, some participants know 6 key. This is for them. I'm giving you quick tip so that I don't confuse beginners here. So knee joint is connected to dryness energy. In new diseases, we can focus yang dryness, and in chronic diseases, we can focus yin dryness. And also, you know about functional and structural. Structural, large intestine, lung meridian carrying dryness energy. Functionally, UV meridian and kidney meridian are carrying dryness energy. So you can choose the meridian accordingly, and there you can work. Yes, you can see the symptom. Like, I'll give example. Let's say this is old age. I'm talking about now energy. It's not related to the pathway, the meridian, which is crossing which is crossing near the kneecap. I'm just talking from energy point of view. So dryness energy, like old age knee problem. So on the yang side, large intestine is carrying dryness. So this is the energy line. This is the meridian for uh, knee treatment. And if person has like especially in old age, maximum dryness energy is involved. Yes. So you can sedate dryness here with red color, tonify heat here with red color, and then you can inform spinal cord meridian, same treatment. So here I'm just giving you the glimpse, and according to the symptom, like swelling is there, you can sedate humidity. If arthritis, inflammation is there, new disease is there. Yes, heat, you can feel the heat in knee area, then you can sedate heat also. So I just wanted to touch this so that you can, your 6 key consciousness opens again. Yes, work on dryness meridian based on structurally and functionally. Okay. Now, tri-origin. Uh, Of course, it also has detailed explanation. But here I'm giving you baby tips. All joints, as per the tri-origin, all joints are controlled by neuter force. Yes. So this is this little finger. We have actually renting procedure. We have layer system, we have skeleton system, bone system, we have structure system. So we can reach knee area, exact knee area, with the help of structure system or layer system. But it has a chain. Yes, it has a very systematic chain. Only with complete triorgan consciousness, you can flow with this chain. But again, uh, why I try to give this big chain information, because I know that some of you have a complete triorgan understanding. So to motivate them, I give this tip. You will catch easily. Now, for beginners' point of view, all joints, joints come under neutral force. And knee is in neutral force. Knee has heterostatus. Hip joint neutral. Knee is hetero. So this joint is very good for treating. This is not just for knee, but for other joints also. But this will also, uh, this is also connected to knee. So knee under neutral force comes in hetero dimension. You can find the painful point here. You can do color therapy here. You can do ring massage here. You can do moksha here. You can do mudra here. Okay, this is the place. So as I told you in the beginning, it is not necessary that you do everything. Yes, you never know which tip hit you. Professor used to say that we have different consciousness. Many people with different consciousness. That is why different consciousness, different point. Yes, what is the cause? Sometimes it is not just medical based, it is consciousness based also. Yes, and which consciousness you are carrying. So you can sometimes correspondence system can help you, insect system or mini system can help you, sometimes meridians. So we should have full awareness. We should know everything. You can start with the best thing is when patient comes to you, then what first step you have to take? You can start with basic system. As I told you, reflection point, correspondent point of knee in basic system, standing position, sitting position. At least you can start with that first. Okay. Insect system as a second choice, you can start slowly, slowly. And if like people having good Sujok knowledge, they know when to use Meridian Sujok key. They know when to use correspondence system, especially in pain symptoms. We do Meridian Sujok key as a first choice. Reduced pain. Sometimes pain is completely gone forever. It doesn't come back again. But sometimes we need to add with Meridian Sujok key, we need to add correspondence system also. Yes. So we should have complete knowledge. Of course, we have diamond energy system also. According to diamond energy system, yes, we have uh, border meridians touching knee, but that requires detailed explanation. So now I want to show quick practical part. I'll share another screen, camera. Just a moment.
Sure, ma'am. And today we won't be taking any more queries.
No,
So
not today.
yes,
Yes.
it's already 1 hour plus. So ma'am has
So,
given.
okay. So what we can do next, maybe next session, we can do complete practical with Moksa. What we have done today, we can do good practical part. But I don't want to rush. I want to show exactly how you will do practical for this. Yes. So you can do revision. You will get recording also, but not soon. Yes, later. So you revise your points and then we can have practical session next time. Of course, we will have question answer session also. Once I finish few joints, and then you can have, we can discuss. Yes, I hope you have understood. We can have a few questions, 2, 3 questions, quick questions, because practical will take time.
I request only 3 hands raised, please, not more. And if anyone takes a lot of time, they'll be muted. Please note. And please put your videos on so that I can just add spotlight. Thank you. Please follow rules.
Yes, please. Yes, you can ask.
Sir, please ask.
Hello,
Sir, please continue. Are you able to hear me?
hello.
No,
Yes,
he's
you
not.
can hear your voice.
Hello.
No. I'll go to next. Ravindranatha sir, we are unable to hear you. I'm sorry. You are unable to hear us actually.
Yes.
Hello. Good evening, ma'am.
Good evening.
Ma'am, this is regarding the 6 key, ma'am. You told for the old age person, if they get knee problem, you have to give dryness. For rheumatoid arthritis, if they have knee pain, what we have to do, ma'am?
Yes. So here we have to add immune. In practical session, I will explore this. So here we have to work on immune system also along with the correspondence area.
Okay. Okay. Thank you very much, ma'am.
Next session, completely focused on practical part. We are not talking theory. Straight away, I will do practical. Yes. And it needs time.
मैम ये स्पाइनल कॉर्ड में आपने 6 की में बताया था कि ड्राइनेस को सिडेशन करना है, तो उसके साथ अपने को हीट को टोन भी करना पड़ेगा ना।
Yes. Yes. It is not on lumbar. It you have to do on the meridian, dryness
ओके, थैंक
meridian.
यू।
Good
Okay.
evening, ma'am.
Evening.
I want to ask that if newborn is born, total bone is paining, is due to less density, side also
Total
paining, right side also paining, but whole
they
bone
are
is kneecap.
kneecap. Yes. Okay. Bony pain. Yes, bony pain. You have to do good muksa because bone pain is very deep pain. Yes, very deep pain. That is why muksa will really help a lot. But if there is inflammation, then don't do muksa. If you feel heat or on touching you feel that skin is warm, then in that case you don't do muksa on Sujok coil. Yes. And then you have to continue with your seed therapy, stimulation and seed therapy. In practical session, I will explore sometimes, I'll give you different examples. Sometimes patient has swelling. Yes, water retention, swelling is there. Sometimes crackle voice. Yes, cut, crackle voice is there. This is dryness symptom. And sometimes stiffness is there. Again, this is dryness symptom. Expansion is there. Uh, and sometimes you see that not only when I talk about knee, it is not just joint, it is complete surrounding area also, skin area also, sometimes skin disease in that knee area also. It will heal complete knee area. After studying today's lecture, at least you can start doing it. Simple, practical, you have understood. Detailed, practical, you can do it on your own also, but detailed, practical part I will explain in next session. And I will touch moksha, how to do moksha. And if possible, I will also show how to do needling. That is why we decided to do next time because it needs 1 hour practical. My ultimate purpose is that you get the result after doing this. If I show quick, then you will miss important thing, important practical part.
Smile gratitude for all the wonderful sessions, ma'am. And all of you, please note, today, ma'am didn't wanted to rush. So that's why all the queries and all the practicals are postponed to next week. Okay. So next week, be ready. All of you add your friends to this session because practical sessions are very important. You will be able to understand it so nicely and you will be able to start doing it on yourself. But till then, whatever is taught today, right? If it is not connecting with your query, then you can watch next week for the whole session and go through it, make notes, and just make it for yourself and all others. Okay. But till then,
After practical, we can have question answer session related to knee.
yes, please. Till then, you can use ring on the whole finger, whichever finger, observe the middle finger in both hands and just do ring. And you can do ring for all the fingers also.
All
Okay.
middle joints especially.
Yes, please. So till then, I'm sending gratitude from all of you to ma'am for this wonderful, beautiful session always, and sending lots and lots of gratefulness for wonderful sessions from ma'am for all of us. Her time, her dedication. We are so grateful to you, ma'am. Thank you. Thank you, and sending gratitude from Joshi's Kerala group to all of you. Thank you for joining in for this session. Gratitude, ma'am. See you next week. Till then, everyone, I request you all to please consider the group, go through it for the messages of live sessions and attend it. Thank you so much. Thank you for attending. Thank you, ma'am. Gratitude and
Thank you so much.
thank you. Ending the session, everyone. Good night.